I'm
So
sorry, I
you'll
couldn't
be
make
there
it up to the event
a million
on
times,
Friday. I went
days
by.
instead of just a few, huh?
It was
Still
awesome.
just gonna.
It was awesome.
Okay, calls the meeting order, we're back in nursing home. We need a motion to accept the previous minutes.
So moved.
Second, Joanne, all in favor? Motion carries. Krista, give us all your good news for the last 2
Good
months.
morning. I know, we weren't here last month, we were in training.
Yep.
So a lot has happened over the past 2 months. We were at national training, in Texas, learning more about our job and what the VA is doing. It seems like they are trying to automate more VA claims to make the process faster for our veterans and families. That process comes with downfalls where, computers aren't people. There's gonna be mistakes that we have to catch on at the back end, as well. So, they are trying to process claims a lot faster, but at the same time, we need to double check things a lot more, because there are a lot more errors. In the office, we had, about 57 visits. That's just Lisa and I at this point. And we keep getting phone calls with new clients every single day. So it's amazing that, the word is getting out there that we are doing our job well and, it travels. So, we had, the Women's Veterans Stand Down. That event was over the weekend and we had just a couple people in person turn out. That is done through the University of Chicago and Lewis University. And those people tended to have great, thoughts on the program, and it's only their second year of doing it. We had a little bit of technology glitch in there on their end, but through it all, it was a lot of great information, and I'm looking forward to doing it again. We did have 30 people that were on it virtually. We just had a couple that were in person, so, other than that, we have done almost $3 million in back pay for this year alone, year to date, I'm sorry. And almost $180,000 in back pay, those totals for this year, which is obviously the highest we've ever been. We've been at the highest we've ever been since April, so it's great. We had the Vietnam Veterans pinning ceremony, and that was on Friday. I'm not sure if you guys were aware of that or not, but we had 54 Vietnam Veterans era people, veterans pinning, excuse me, a couple Gold Star, which are family members of those that are fallen, and the turnout was fantastic. It rained right as soon as we walked outside, of course. But they still, through it all, were smiling and loved it. It was a great turnout. So, the other thing is we have legislation that is soon to be passed. We didn't ever think it was going to pass. And that is, more about the burn pits and also our Vietnam vets, where it adds a few contentions that are presumed conditions, which is just going to up our caseload. Meaning, for instance, we didn't ever think that Vietnam vets would be presumed to have hypertension, excuse me. And hypertension was always one of those that's, you can have it in the family, whatever, nobody ever thought. Even the veterans case lawyers that were on staff at our training didn't ever think it was ever gonna pass. But it did. It's on the president's desk now to decide. So we should know fairly soon if that's gonna pass. If that does, that just us, we have over 20 veterans that we know of that we need to really recheck their case files and see if we can help them any further. And that's just in our office that we know of currently. We always have to, recheck everything and see if we're up to date on everybody's cases and see if there's anything else we can do for them. That and families. There's also locations going to be added. Those locations helps family members that may have never thought they would get, benefits and everything, but now they are. So we gotta be able to file for them as well. So that means that Lisa and I's jobs just got a heck of a a lot more busy. We are hiring still. That job posting goes through July 22nd. We do have over 42 applicants right now, which is great. We have out of those 42, probably good 10 that are veterans. We're looking, veteran preferred, but obviously if somebody outside of being veteran has more experience or better credentials, then we have to look at that as well. Other than that, we have a health and wellness fair that is coming up that we're putting on in August. I have a flyer out for that as well. That is going to be more of the, yoga, nutritional health drinks, meditation, massage, that sort of thing. Then focusing on mental health, because we've done a lot of mental health, so we want to take other aspects of health and bring that to our office. So if anybody has any questions or issues or concerns or anything like that, we're open to.
Did you bring the flyer?
Yes, ma'am, it's great.
So other programs that you were gonna bring in, how do they go?
The programs we were going to bring in.
Give me, I have programs down through there.
So we have like, Heinz comes down for healthcare. We have Humana Insurance that comes down to help with veterans that are on Medicare and in the VA healthcare program. We have the Heinz Homeless comes down, and then we have Midwest Shelter for Homeless Veterans also comes down. We have been gifted a ton of bags that are, filled with any sort of household products to personal care products and everything else to hand out to veterans as well. So, they're standing.
Now, do you work with the homeless shelter there in Peru?
Ads, yes, they are very aware that we are there, and we also reach out at the Women's Veterans Stand Down event. We had food catered in to us by them, by Chicago, and we had a plethora of food, so we ended up just bringing it over there and giving that to them. And then we have gift bags that are women veteran specific, so we are dropping those off to the VA home to give to all the women veterans over there.
Anybody else have any questions? Where's Mike go?
I have no idea.
He thought he was in the wrong meeting.
Yeah, he went to find a different meeting.
Too quiet. He usually has all his questions.
Ton of questions. So yeah.
Any other questions, comments? We need a motion to accept the monthly report that was on file. Luann, Kathy, all in favor?
Aye.
Opposed? Motion carries. Then we need a motion to pay your bills. Kathy? Okay, motion kicked, or all in favor?
Aye.
I gotta take this one. Josh? Yeah.
Yeah, I mean, they were all doing good, and I mean, they didn't say bringing them along slow, and now, we got 3 more good. But they had, well, he's on a trend or something. I know Adam felt terrible, Jared called Adam, and he came over. Adam, he's gonna, I hope you guys have that, so.
Like I said, I know
Yeah.
Yeah, fine.
If there's nothing in it, so I basically put all the lines back in there, and you tell me what you do.
Okay, sorry.
Yeah, so if there's like been no basement or anything.
Okay, we got a motion to accept the report and also to pay the bills, correct?
Yes.
Okay. Come on. Carrie.
Good morning. Okay, for the activity department, the new employee and activities has transitioned well. The activity director has been cleaning and reorganizing activities to make the office and activity area more efficient. Outings are happening with residents and they love that. We're planning a garage sale for September to raise money for the activity department. The activity consultant has been in doing her visits and working on forms for documentation purposes. For admissions, 4 admissions, 1 deferred, it's postponing until July, 1 discharge home and 1 death, facility average is 50. June admissions and marketing calls include speaking with all contracted hospice services providers about making referrals to LaSalle County Nursing Home. This rider traveled to the OSF area discharge planning call center in Peoria to discuss admissions and referrals with discharge planners and case managers. Efficiency in the referral process was discussed and agreement was reached. The discharge planners will now email admissions a daily coverage schedule with phone numbers of each agent included, so that the correct contact can be quickly reached to coordinate efficient transition of care, including obtaining required rapid tests for COVID and contacting OmniCare Pharmacy directly if a patient is discharging with a black box medication prescription. Continued tours and promotional visits among the communities continues, including in-person calls to area hospital facilities and care agencies. Employee incident reports, there were none for June, so we're still 1 employee and 1 visitor for the year. For the nursing department, restorative programs, there's 130 total programs, 42 range of motion, 10 eating, 37 dressing and grooming, 10 walk to dine ambulation, and 31 toileting. We continue to participate in IDPH webinars. They have been recently changed to bi-weekly instead of weekly. We are no longer in outbreak status as of 6/14. But this weekend, we are. So the report says one thing, we changed rapidly right after that. So we have 1 positive staff member out. Our current testing protocol remains twice weekly for all unvaccinated or not up-to-date staff. Testing days are Tuesdays and Fridays. We continue to follow and initiate all recommendations from CDC and the health department and IDPH. Our current county level transmission is high. Due to our current high transmission level, all staff are currently required to wear surgical procedure masks at all times as well as eye protection. Infection control nurse has given all residents their boosters who are due and staff who wanted and were due as well. Notes are being sent to healthcare power attorneys in response to the CDC's recommendation for a second COVID booster for immunocompromised individuals over age of 50. A clinic will be prepared for all residents who are wanting their second booster. For serial testing of unvaccinated staff, the facility continues to use rapid tests. These are also known as point of care tests, and they're supplied by the federal government and health department. We continue with screening measures to enter the building. All staff and visitors are screened before entering into the building at this time. Our visitors are to wear face masks at all times. Masks must be adorned prior to entry and not removed unless within a safe distance from others for a short period of time, and that would be outside. Residents continue to be monitored every shift for a full set of vital signs. All physicians continue to come in for rounds except for our house psychologist who continues to see residents by telehealth. We've hired 2 full-time CNAs for midnight shift as well as 2 part-time CNAs for midnight. We have also hired 3 full-time CNAs for afternoon shift and a part-time CNA for PMs as well. And she continues to interview CNAs to fill in the available spots. So we do have quite a few that just were hired and are getting trained. As far as my report, it's been a busy month. The benefit liaison is still in training and she's doing very well. We look forward to the help she can bring us in coordinating the benefits upon admission and her excellent teamwork that she has shown. It has alleviated the financial officer of those tasks to work out the MMAI snags and any collectible AR within the time limits. Revenue should start generating more timely and accurately, which it did start this month. That was great. They did an audit on each account for any issues as well as working with point-click care with claims that had to be manually corrected for each resident. Each resident and their insurance has to be examined and made sure it's billed properly. This is very time consuming, but it's coming along well. An audit on the in-house checkbooks to make sure they were all up to date and balance was completed. We found there were a few months that private pay money was not written to the treasurer's department. That was early on, so that was corrected and deposited. The Medicare cost report analysis desk review came back and they owed us a sum of $26,619.
Us?
Yeah.
Usually it's the other way around.
Yeah. So we received that on 6/28. I was approached by Telegen. It's a partnered CMS National Health Solutions organization to speak at a seminar on emergency preparedness as it relates to us during our tornado and floods. They heard we were hit by a tornado in 2017 and would like us to speak on that as well as our emergency preparedness policy. They will be speaking to the nation of healthcare, and they feel we have a valuable experience to contribute. This seminar will be featured on the website for everyone to view. We feel honored that we can do this and possibly help others prepare for emergencies. That live seminar is July 20th, and I have had 2 kind of like dry runs with it so far. It's going great. CMS has put out a bulletin on their phase 3 guidance for new policies and regulations concerning infection control, multi-bed wards, and we still have a few, QAPI, mental health, and voluntary discharge and abuse are among some of the changes. Once those are put into effect, we will be writing and initiating all policies and procedures along with education, and then I will have to bring to the meeting what we want to do with the 4-bed wards, because they're phasing them out.
You know, how many do we have?
2. I think we have 2. I believe. Yeah, so we'll have to phase them out. We'll have to decertify. It's 2 rooms, so 4 beds. Because there's 4 beds in each.
Okay, yeah, go ahead.
So that'd bring us down to 75. Okay, I've received a name, this is the next page. I'm sure I got this right. Yes. I've received a name of a contact regarding help with the hospice wing that I've been talking about, and I spoke with her. She's worked in long-term care administration for county nursing homes for many years. She has served on a board of Illinois Nursing Home Administration Association. She's a wealth of knowledge and a pleasure to speak with. I'm really happy that I have her as a contact now. I have reached out to our local hospice agencies via fax about our hospice wing pilot program. They have responded with interest to meet with me and discuss the program. They've all been wonderful and are very interested in partnering with LaSalle County Nursing Home. In working with these agencies, we can utilize D-Wing for their residents to provide a more like home-like experience. The consensus seems to be, when we have 4, I've met with all of them. The consensus seems to be we could be utilized more for respite hospice services, so in for like 5 days, basically to give the family a little time, and then they would go out. That generates more revenue for us. So far, one of them pays us 100%. They don't get any money for that. They pay us 100%. So that would be a good avenue for us. There's a big need in this area. At this time, a lot of them utilize the hospital. With respite services, admissions could be more frequent. We could provide the more home-like setting for these patients. This will not only help increase admissions, it will also help out our local partnering hospice entities get a bed quicker for their patients when the time comes. They're having trouble with that now. The wing could have aromatherapy activities centered around quiet end-of-life circumstances, trained staff on end-of-life care, music therapy, and the list goes on. We would be the only nursing home in the area with this type of service. There is no special licensing needed for this. As we proceed and become familiar with each of their services, we could transition also into general inpatient. General inpatient does generate a lot more revenue. You have to have an RN on for 24 hours a day though, because you're titrating morphine, it's a morphine drip, it's to get them comfortable. So that could be something we could work up to. We're very excited about this new endeavor, looking for support. I've reached out to OSF in Ottawa to speak with the admissions manager regarding being a preferred provider. I'm waiting to return call, she's been on vacation. We received from IDPH a staffing requirement fine that nursing homes are receiving. Leading Age has reached out to us as well as IDPH and the governor's office to discuss this mistake. The hours did not reflect LPN hours. We at LaSalle County Nursing Home work diligently to ensure staffing numbers are calculated and staffed appropriately, even if that means management works the floor. Hopefully this gets resolved soon. The fine was for a little over $13,000. And I have them calculating what it should be, if anything, and that should be done today. We have a spreadsheet that will calculate IDPH total hours what should be fined, if anything. We'll have this ready should the state decide to continue with any and all fines as stated, and the appeal goes forward. The appeal was overnighted on Friday. And the stipulation additional to the fine, it states a sign is to be posted at all main entryways as well as on the facility webpage, the following. Notice stated in current. This facility does not currently meet the minimum staffing requirements by state law. posted at the direction of Illinois Department of Public Health because we have appealed. The posting has been stayed until further guidance. And I met with Leading Age. There was a webinar for Leading Age with many nursing homes because they all got it. Some of them 600,000 and plus. And we all are appealing it. We're planning a fall fundraiser for the Sauk County Nursing Home for the first weekend of October. I would like to advertise the new hospice wing and do a fundraiser for furniture, bedding, supplies for the wing and building. The fundraiser would include our area hospices, and they all agreed they would do this, with booths of their choosing of activities, a fall carnival for kids to enjoy, games, snow cones, and face painting. We could have craft booths with fall decor and possibly a cruise into the community. We'd like to have food trucks, musical entertainment, then a speech by me promoting our nursing home and our healthcare partners, and a big thank you to all healthcare who have endured the pandemic right along with us. We are here for a community and want to acknowledge that. And that's it, the rest is the agenda items.
Any questions so far?
I did attach with report the CMS targeting staff, resident capacity. This is the new guidance.
For that hospice wing, you said there's like 4 providers here.
We have 4 that we're contracted with, yes.
So I mean, you would work with all 4 of them in that wing,
Yes.
and we would provide the full-time 24-hour RN.
If that, it's not needed unless we go to general inpatient, which that could be in the future. Right now, we could utilize LPNs. I would like to advertise for staff to work specifically just for the hospice wing and have them trained by the area hospices, which they all are totally for that, on end-of-life care, because there's a little more to it. Especially with morphine, a lot of people are scared to get morphine, and end-of-life, it really helps them. So they would be a little more trained, and they would be down there. But you don't have to have RN total coverage for respite or in-house. So the D wing, there's 22 rooms down there we could utilize. So any hospice patient we have in-house could go down there. And then a certain section would be available for the area hospices should they have a resident patient, someone they need to get in right away. We'd be already partnered with them, so we would take in their patient. And they all are really excited about it.
And then we were talking about this fine from the state. How are they calculating staffing needs? Same way as they were, or have they upped the staffing rate when they gave you more money?
That's completely separate. That is the new rate reform, so that's different. This is, we had to start, Director of Nursing has to go in for IDPH and put in our census of the residents. And they're skilled or not skilled. And then my HR has to do the PB&J, which puts in all the hours for our staff. The state calculates those and makes sure, which we do the ratios too, that's how we know what staff, that we have appropriate numbers. They didn't calculate it correctly. They didn't calculate LPNs in the process. So it looks like every day for the first quarter from January until March that we were missing nurses, but they didn't calculate the LPNs. So we shouldn't have a fine. But that's a problem. So Leading Age is basically fighting for that, and they have a conference today.
That should be resolved.
It should. If not, they continue, then we'll appeal. We went through all of our numbers last week. We took because every day you have a daily census. You have to calculate your hours, then you have your staff sheet, and you have to make sure they match. So that's what we did last week, is went through every day for the last quarter to make sure all of our staffing numbers were there. Then we have a spreadsheet that Leading Age sent us, and you can put in all the hours, and it calculates if you should owe money according to what it's supposed to be. And we're finishing that today. So that would be our proof for the appeal. Should we appeal? Should they do that and not take it back? Personally, I don't see how they can't take that back because it's an error and leading age is fighting, and it's many nursing homes in Illinois.
So is this a different spreadsheet than what you use normally?
Yes, this was the state spreadsheet, how they calculate everything, so leading age copied it and made it available to us, so we could use it and put in our information, and it automatically calculates what we should owe. So we have access to that now, yeah.
Larry, so the state of Illinois miscalculated on the figures that we gave them?
So they take a certain percentage, and I don't know the formula, I don't know how they do it. But they take a certain percentage, they do a calculation, and they have an average amount, how much they pay CNAs, LPNs, and RNs. And however many hours they show we're short, they take those calculations times what they think a CNA, RN, LPN should be paid, and then that is the rate that they charge us. Yep.
And this leading age is an organization that,
Yeah, it's for nursing homes, it's a big organization, yeah.
and do we belong to that?
Yes.
Oh, right. Ever since I've been here, I've heard, everybody, a lot of board members talking, saying they wanna close the nursing home down. What's the odds of this happening? Because you're going out there, you're getting fundraisers, you're opening up your new wing. I mean, what's the sense of doing all that if you think you're gonna close the place down? That's my question. So if you're gonna keep it going, you're gonna keep doing nice stuff, you're gonna do fundraisers and stuff, or you're gonna close it down? What's the plan? Because there's no sense in wasting people's money for donations and stuff for something that's gonna be closed down. What's going on?
Well, I got the minutes from the last board meeting. I could not make it that day. My brother had COVID and I had corn to side dress. And I was very disappointed when the county board agreed on how they were gonna rank and spend ARP money. Then I heard that it was tabled for the nursing home when they made it in the percentages that was going to be handed out. And I don't know what the discussion was, it just says it's a lengthy discussion. Maybe the chairman of the board could fill me in.
I don't, like I say, I just heard from a few board members, it's getting pretty serious and that's what their plan is to do it. So whether it's true or not, I don't know, but like I say, she's wasting her time and all this other stuff if you're doing it.
Yeah, I agree.
So you need to get up, either shit her out the pot. You're gonna do it or you're not.
What was the discussion at the full board meeting, the reason that it was tabled? I mean, somebody needs to be honest with me and tell me what, they want to, what, put it on a ballot?
Well, that was a possibility. Yeah, that was suggested. Yeah. Well, yeah, another issue we have is the tax rate is only at half of what's allowable.
It's less than half.
No, it's just a tad over. I have it's like 0.502, and we can go to 0.10. The last sheet that I got, I mean, we're talking.
Well, the rate that they sent out for all the taxing districts, it was 0.04716
For 2020?
for the taxes we are paying right now.
This is 0.05025 right now from this 2021.
Oh, that sheet that we just was handed out with all the taxing districts in the whole county.
Yeah, these are the calculations right here that we ended up at.
We still have almost a full percentage.
Yeah.
Well, that's why I said it. It's probably small dollar.
My opinion, it should stay open. But I'm 129.
That's what I feel. Like I said.
Gary,
here-
I was very disappointed in what came out of the county board that day too. You know, I mean, we spend money on all kinds of stuff, but if we can't help the elderly and the ones that are sick, and we can't spend a couple nickels or we can't spend money for that, then we're wrong, in my opinion. You know, there was one time I was thinking maybe we should, but I've changed my mind. I've had people, you know, I've kind of thrown this out in my area over in the eastern part of the county. And I do know some people that own a lot of, I'm gonna go with the farming community, that own a lot of farm ground that had people in there, relatives, parents, what have you. And I said, are you speaking just because of emotion right now? Because of the care and stuff? I said, you know, because there's a difference between emotion and reality.
Yeah.
And I mean, you know, they're all like, no, we should take care of and have a place that's reasonable. And they said, where are them 60 or 50 people gonna go? If you close it down, then where's them 50 people gonna go? Because you can't get into these other, you know. But I was disappointed in the county board that day myself with the discussion. I was also disappointed because I thought our ARP guy was kind of here for ARP, but it sounded like he was here to kind of, you know, he's bringing up about Champaign County, and I'm looking at this guy, you know, mind your own business, dude. Do what you're supposed to do. Don't come in here throwing that. He was wrong, in my opinion.
Well, he was,
No, he was wrong. I'm sorry. My opinion. I got my opinion.
yeah,
He was wrong. You're not gonna change it.
well, he was only presenting other possibilities in that, you know. My perspective in this whole situation is you have economics at this point in time, and from COVID and that, just recovering from that, and still we're in the midst of it, as was just mentioned earlier. You know, my thoughts are on taking a look at what will happen in the next year or two, because it's gonna take that long to find out the possibility, if you're even going to be able to get up to census to make it work. To do it in the short term here, I think is a little bit short-sighted. I think you have to take the longer look at it, because you have problems in hiring personnel, and you have problems in getting people into the nursing home, particularly under the current circumstances that we have with COVID. Because it's here, and it's going to be here. Do we have a nursing home that is using proper protocol to keep the residents safe? I believe we do. I think the question was, part of it was in regard to the lost revenue. I think it was $1 million something, I can't remember.
$1.2 million. Over $1.2 million is lost revenue.
Well, when Stephanie and I ran through when this whole thing first started, when we first ran through the eligible period for lost revenues for just the nursing home itself, it was $400,000. And that, you could conclude, was from COVID. You know, but I think it's still ongoing.
Well, yeah, I mean, people are not wanting to take one.
There's all sorts of alternatives, and then plus you have the leftover emotions from what happened when the nursing homes were shut down and people couldn't visit their relatives and things, or their spouses and things of that nature. So there's some of that still exists. So do we want to make our decision, put on the ballot based upon this short-term situation, or do we want to take a look at it more long-term and see what will shake out in the next year or two?
Well, and I mean, you gotta look at it over the baby boomers are all, I'm towards the end of the baby boomers, there's a bunch of them older than me. There's a lot of people retired and eventually, probably a quarter of them are gonna need somewhere to go in the next 10 to 15 years.
Yeah.
So I mean,
I think this hospice wing possibility is another means of helping take care of that. That's just my opinion.
Yes, Mike?
My turn. Okay, so what I did over the last couple months, I went and downloaded the state statute when it comes to nursing home responsibilities. There's nothing in here about anybody having to close anything down because of, there are regulations and rules that we've got to follow. We have been a 5-star facility since I've been on this committee. When they come in from IDPH, they come up with some crazy stuff just to find problems, as we found out. They didn't like the way the fireproofing went through the walls after we just had the building certified by IDPH a month before. They had a re-inspection and we had to spend another $40,000 to have that done. We had a situation where they watched the staff when they didn't replace their gloves on their hands as they moved from cart to cart in hallways after they had been in a patient's room. So they're grasping at straws. So I take that to the staff and their excellence and the quality of care that they give. We have never had a real serious problem down there that ended up being, I think, that costly, but I've got to qualify that. When I first showed up, there was an ongoing case where we didn't follow proper dietary protocol, particular resident, and that ended up with a loss of life, if I remember.
I don't think it was.
I have to bring it up because those were the liabilities that we were involved. We were paying like $4,000 or $5,000 a month for some attorney out in Pennsylvania because he was a nursing.
No,
Where was that guy from that we were?
we got in trouble with IDPH because, and fined, and lawsuits, because
A resident.
a resident,
Let me walk you through this.
it was.
The nut bread case is what I remember in the back of my head.
Well, this was where a guy was touching,
Oh, inappropriate, okay.
Inappropriate action.
Inappropriate actions.
and it wasn't
Those are the two, okay.
it wasn't reported, they got them to handle it in-house, and it wasn't taken care of right.
The protocol. After the fact. And unfortunately, in anything, and you have to give, in my estimation, a little bit of forgiveness of misunderstanding. Because how in the world can you really think things through that you can have yourself in a perfect environment? Some of these things are going to happen. And it's unfortunate that they do happen, but after we did find out, we eventually got to that point where we corrected the situation, and we're better for it. We're better for it. So, with that said, I said, well, money's a very important in nursing care. So in 1990, we had the referendum, that went through.
What year was it?
1990, yeah.
November 6th.
On the November 6th ballot to whether we should. It ended up such that we did pass that referendum to support the nursing home. And then talked to Christy downstairs, and that sheet that we have, we didn't start taxing until 1994. And right now our current tax rate is at a nickel plus some. So we're being responsible to the taxpayer itself when we look at what we are charging for support services. And I came in here not too long ago, and I've done it at 2 meetings. Okay, Finance Committee, if that's what you want to feel, if you want to be bean counters, and you won't have a heart or any of that kind of stuff, I'll play into your hands. And since then, and Mr. Lee brought it about eloquently. I was out knocking on doors, and that was one of my questions. Should we be providing health care? And it was very important to the folks that I talked to, the compassion that they love, that they have for all of the residents of LaSalle County. It is a great service. And as you know where I came from, I was very adamant. Okay, I'll play into that finance committee. At our last finance committee, we're going to now hire somebody to come in and tell us what the hell we're doing wrong. And that, to me, is just totally foreign.
Well, I mean, actually, I think they
Let's
ought to
create a PDF, whether we approve it or not, at finance.
talk to this lady that you talked to. This, contact regarding help with hospice wing, and spoke with her. She worked in long-term care administrator. We need someone like her to come in and kind of look at our whole program and maybe give you some ideas, or the county some ideas on ways we could attract more residents.
She told me to call her back anytime, she was a wealth of knowledge. She in fact starting a hospice unit, where she was before she retired. So that's route she went, because that nursing home, wasn't doing so well either. So I just thought it was kind of funny that she did the same thing.
And I have to admit, from what I know of healthcare, I know there's friendly competition, and I call it the private not-for-profits. But what we look at as to what we charge for our daily room rates, we can make a big difference financially.
No, you can't.
We can make the bean counters happy financially that we are assessing. I get it.
Oh, yeah, you
Alright?
can.
And that's where we're at right now. Every time I go to a finance committee meeting, we're losing money, the end of the world is coming. We gotta shut the place down. The reality of the argument. Now, there are things that we can do, as we just found out, to be able to provide for proper room charges, respectful room charges, because we are asking the people to support us.
But I mean,
It's part of that balance.
the room charges were $100 a day less than
Yeah.
average, probably.
I did call around and get.
Yeah, I see you got the charges here,
Yeah.
but those room charges, that's only for private pay. And less than 25% of our people are private pay. So really, dollar-wise, it's, even if you raise it up to what the average is, it isn't gonna really be that much more income.
And maybe it can help me out, some of us that have been on the committee for the longest time. That is an eloquent way of looking at it, or a very respectful way of looking at it as to what private pay pays. But unfortunately, we're taking and subsidizing, is that the right word? The Medicare, Medicaid charges. And there are opportunities for us, as in other facilities, where they make the family itself liable. They do have certain grants available for the very, very destitute, from what I understand, out of their goodness of their heart. But even at that, the actual charges are a lot more than what we are involved with. Am I saying that respectfully?
But
For
Medicare,
what we're
Medicaid.
giving the Medicare, Medicaid people,
Medicaid, when you go to Medicaid, you pay your Social Security and any pension you have.
Yeah.
And I mean, and then Medicaid makes up the
the
difference.
difference.
But I mean, some people may have a really good Social Security and pension, but they may be $10 a day less than what short, so Medicaid may only pay $10 a day. The next person, Medicaid may have to pay $190 a day, depending on what they have for assets and income. So I mean, just because you say Medicaid, that doesn't mean the state is paying it all. Whatever income those people have is put towards it.
I just can't be that callous if I've heard some of the arguments as what we've heard so far.
Well,
And it's very
we
difficult.
spend almost as much money to provide health care for the inmates
Well, it's $2.5 million.
Huh?
That's $2.5 million over there with the contracts that we have there. Just off the top of my head,
Well, not quite 2.5.
that doesn't,
I mean, healthcare, healthcare,
yeah,
county taxpayers pay as much for that care as what they do to support the nursing home.
but bottom line for me is the fact is, after I went around knocking on doors, there was a lot of compassion and understanding. And that nickel is not gonna make anybody destitute that is doing the right thing. For the fact being said is that, you know, someone else paid that forward for maybe myself. When I get to that point, I think you eloquently put and pointed that out earlier in the conversation.
Yeah, cause I
And
figured,
I changed my mind too.
I figured my house, and it cost me about probably $33, $34 a year.
When we go out after our meetings, I bring that up very quickly. I say that lightheartedly, but I'm just saying it's, yeah, the priorities of providing for services and care for our older community.
Well, Carrie, I wish you would contact this person and ask her if she does consulting like that. And if she would send a proposal, because finance was gonna put an ad in the paper, I believe.
Hasn't happened yet.
It hasn't?
Has not. Waiting for information.
For a consultant.
For a consultant. I think,
Call her today.
I mean, there's nothing wrong with having someone come in and look and maybe give you ideas on what you can do. But I mean, most of consultants are just on nursing home care. And I mean, like DeKalb County, they have a consultant, but their consultant is trying to help sell the building, isn't it? They haven't actually run the building themselves for several years. When?
So we're looking for a consultant that's going to direct us in better patient care and more financial stability. Is that where we're going, or?
Well, I mean, I think
What do we need? What is it that we actually need?
we need someone to look at whether we should go into this hospice thing or other ways to attract private pay patients. But I mean,
So it's,
like Don said, we're in this COVID. Nobody really wants to send their family member to a nursing home right now.
and that's the issue with all of the nursing homes all over. They do not have the residents coming in, and they do not have the staffing that's necessary. I don't think it's no reflection on us. It's just the way of the world right now. They do not want to put their loved ones in a nursing home. And
Plus now people will be getting fined if they're not staffing appropriately. So you have to watch taking admissions and not having the staff, because you're gonna get fined.
yes. And we were fined before, weren't we?
On this,
No, I just mean, we had standards to maintain a ratio of staff to residents, always, that's always been around, so that's nothing new.
nothing new, they're just,
But just they're finding us more now.
Well, I mean, IPH always come in every year and do the survey. And I mean, they've always found something.
Well, you better close the
you
library.
want them to, you want them to, otherwise you'll have the feds in your building.
Yeah.
You've had that before,
Yeah.
and they will find things, they'll find a lot.
Have they been here yet this year?
No, still waiting. All right, let's get it over.
So I mean, it's just, which is good to have them come in and,
It's a learning experience. I tell them every time, I'm always friendly. If we're not doing something right, it's not because we're not just doing it. Maybe we don't know. Educate us. And we'll fix it.
or somebody forgets to take the gloves off when they go out of one room and they're really busy in that. And they got 3 beepers going off, need to go to other rooms.
You
Get
can't
in a hurry.
expect perfect, but yeah.
Everybody makes mistakes.
Not being donors.
You got, Bob, no?
Oh, sorry.
Okay, we'll keep moving on. I know it's gonna come up again a little more about the ARP funding, I'm sure it will.
Gary,
Oh, yes.
so do we have an amount that we want to stay under to hire this individual? Do we need to
They-
recommend to the finance? a dollar
Finance was
amount?
gonna put an what do you call it? RFP out to get someone to respond, and they would say what they were gonna charge. Finance is paying the bill.
Finance is good, okay, so
Well,
it's
put
coming
that
out of the general
responsibility-
fund?
I think they're looking at two right now, and Carrie, you might wanna relay that message or, as far as that particular individual.
To who? You mean tell her?
Ryan Dawes for Pat Herman, possibly, it seems to me Pat Herman might have found two individuals, a firm, if I'm not mistaken.
Found two RFPs, some other counties.
And so I might wanna include that other one as a possibility to get in on the RFP.
I mean, I think it'd be good to have someone that actually has run a nursing home as administrator.
And to try to salvage it, absolutely. She's been through all of it, she was very nice about it, so.
Oh, Tom, sorry.
I'd just like to mention one thing about the hospice, I have personally been involved with that over the years, and the big danger point, as was mentioned, is the level of narcotics that are handled. And that really has to be watched very closely, because that's the first place problems can arise.
That wouldn't be any different because we have them in-house now.
Yeah,
So,
well,
yeah, it's all the same. They do require more, but
right, that's the big thing, and more people handling them, there's more opportunities, especially when you got the family working closely with the hospice people. And, I've heard of cases where pills were handed to the patient, and a member of the family was in the room and said, well, I'll hold those, you're gonna eat first and then take these. And then they're gone, never get them. So I know it sounds cruel, but it does happen. And we really have to be prepared for that type of situation, much more now than we've ever been in the past. Where, whether it's family or whether it's a staff member or whoever, but it's there, it's gonna.
Whoever does something like that should get fired next 5 hours. They should make sure that patient takes that pill.
Well, that's how abuses happen.
No, I'm just saying they should get fired.
Well, that's fine, but I mean, that's after the fact, and that's the
And I can't
situation.
see too
We need to look at it from the
My mom
standpoint.
was at hospice and they made sure she took it, they would take it.
Oh, I know,
Well, my dad was at hospice at home.
right,
They gave us the tray of stuff.
well,
And it was for us to administer. I mean, the nurse stopped in and checked the tray.
sure,
But,
yeah, well, but that's a situation. There's a lot of cold-hearted people out there that addicts, and they will do anything to,
yep.
fulfill their addiction.
Okay, moving on the agenda, we discussed that enough. Okay, room rates.
we called around to find the local room rates that are current, and, I kind of went off that. I kept it underneath. Do you have, Amanda, do you have the proposal?
Yeah, I got it right.
You got it, okay.
Well, yeah, you have it on your sheet,
Good. Oh, yes, I did.
on the agenda. Private room rate. Currently, we're at 197. Carrie's proposal is 207. Semi-private, 195, currently at 185. Expanded semi-private, 203.
Current, 193.
Yeah.
And I looked at the lowest in the area on their private and semi-private. And that's basically how I was going up with my numbers. So the lowest private is 224, and the semi-private is 204.
I think that is fine, but at the present time, I'm sure that is probably gonna be changed before the board.
Thanks, Stephanie.
No problem. Hey, we did cut your garbage bill in half. Hey, we're looking for every way to save money.
Thank you.
All we can do is work together, right?
That's right.
Gary, when was the last increase that we had? Was it in January?
Yeah, it was last year.
January
Yeah, it
of
starts
2022?
2022 it started, yes.
Yeah, we went up, did we go 15 last year? I think it was
Yeah. Finance.
12, 15, somewhere in there. What's everybody's opinion? I know we're gonna catch hell, because, well, you need money, and you only raise it $10 a day, and the lowest is 224, Ronnie, you should be the same as the lowest.
I know, I was thinking, I didn't know which way to go, so I'm like, well, if I do it too high, then they're gonna tell me I went too high, so
They,
whoever,
People in general.
the
yes,
people are gonna pay the bill? Okay.
state.
Back in 2000, if I may,
Yes.
back in 2020, the private pay in April, so that's from November to April, was $550,000. Okay. Medicare was 100,000, public assistance, IDPA, 700,000, and other insurance, zero, other revenue, 100. So that's kind of where we're at. That's 2 years ago. So we have to do the math, and I'm not good at that, as to what we want to try to decide. If they're going to take and increase the private room rate, that's almost approximately what, $3,000 a month? No, 300.
Well, you said how much money was it, private pay that month?
Private pay accumulated from November to.
Well, how much was it that month?
That month alone was $111,000. That 2 years ago. And since then, we've had two.
Okay, now, what was the census?
Oh, boy. Let me see if I can find that.
Should be able to top
35? At 35, that was during the beginning and the end of,
I don't think that's right. I think that
It
was
doesn't
from
seem-
the month before.
oh, that's a Medicare census. How they accumulate.
Total, 46,
Okay,
right?
40,
Yeah.
46. That's about right where we're at right now then.
But sometimes, some months, if they don't get that in, then they'll get it in next month, so it's,
Yeah, that's hard.
yeah.
Did you do, financials?
CIC was down, so I couldn't, but all I could get done was revenue. So I have revenue page here, that's on the back.
Oh, it's on.
Yeah, CIC was down, so the bill that didn't get done. I was working on that today.
Oh, yeah.
So we brought in 283,720 last month.
Actually,
Which went up.
I think you did the agenda twice. So
Yeah.
you didn't get revenue on that.
You didn't get the revenue? No.
No, that she,
What? So I,
Oh, I got,
I
you
own,
know what?
You had two agendas.
Let me get a different one because I ran,
I got one here,
you got one?
this right here.
Are they on the other ones?
They might be. I probably made the wrong copies because I ran out.
yeah, I got two agendas there.
February, there's a one from February.
There's another one.
Looks like a pretty good range.
No, what
You want some copies?
Yeah, I can make copies.
I'll get
Just
it.
the general marine grade, nice.
Is that right?
Yeah, I must tell them, Jared,
It's here?
red, white, blue, bridge, got 2.5 inches the other day, over by there.
You want mine? They're making copies.
Oh, no, go ahead.
We'll wait for that.
Gary, I do appreciate your efforts and everything you're trying to do. I really do.
Oh, yeah.
Thank you.
So,
So what is your guys' opinion on our room rates?
who?
Room rates.
Room rates.
You want to just send this on and see what happens with the full board?
I know what's gonna happen,
I know they're gonna, but I don't know where no matter where we set it, they're gonna complain about it.
Is it gonna be that big of a political issue? So I have to pull all of the stops out to bleed the heart?
The way I look at it, if you're private pay, there's probably 99% chance you still own a home. And you're paying taxes.
It's 14% of the daily census. 15% of private pay in the facility. There's private pay.
No, we can figure days in a month, 30 every month. So it's 360 days, figure per year.
Yeah, that's what I figured.
I just, if we wanna, have I?
If you did.
The only thing I can really see with raising it more, a lot of our residents are public aid pending, they come in public aid. So our reimbursement is gonna be less than our room rates for a lot of those. If they don't have social security, all we're getting is the public aid, and we're gonna get less what our room rate is for that day, that month. That's the only thing I can think of going all the way up.
That's fine.
So how much transitioning do we get? Or the fact is, that, as we all know, we all start out in life and we all have our assets. And then all of a sudden we get older, our kids wanna kick us to the curb. And we end up in private pay with what we have as well. If we weren't smart enough to be able to shield that income. And that's what, a 5-year look ahead, where that can be shielded. So there's ways to work the system.
That is if you trust your kids.
No, mine? No, and these are adult conversations, and we all know what goes on. And the thing is that being able to take and to transitioning from the private pay, how much of that group comes into our facility after a period of maybe 2 months, 3 months, go to private pay, are they working towards the Medicare, or Medicaid, the Medicaid aspect?
Majority,
The majority
yes,
will eventually on Medicaid.
yes.
So the wherewithal that they have coming into the facility isn't all that great, unless the family's been able to shield it. Which is, that's the cost of doing business. I mean, they do it up the veterans facility, all the facilities are the same way.
In fact, that's why I think we have a little bit of a benefit, because we have the benefit liaison who can get people on public aid right away. A lot of places only have a couple public aid beds. We're all public aid Medicare certified, so we can take more public aid. So we're gonna have more public aid. But we'll have more private pay too, because they're paying less to be there. It's the Medicare that we're just not getting. But I plan on meeting with the hospital soon. That's not promising anything, but I plan to meet with them and see what they can do.
Tom,
I think that's gonna be a tough go-between, because right now, the hospitals have their own Medicaid facility up in Mendota. My understanding, they're using the Mendota Hospital as a Medicaid facility. So that's a, you know,
For,
You mean like a swing
for
bed?
care, nursing home
Like
care.
swing bed?
in the hospital, they have a section that they're using for that stuff.
They do the swing, it's like a swing bed where they transition there and they use more of their days. Then they'll go to nursing home when they run out of the money, basically. That happens.
So I know people that had surgery and they recommended that they go there for their recoup time and then release.
The important,
Yes.
the important care I know over in Liberty Village is a lot like that. And we're very fortunate with the rooms that we do have available in the Illinois Valley, that we still have to have Liberty Village to provide for that bounce back and then eventually transition into the facility itself. And they're all like that pretty much? Yeah.
That's why I really think our goal is to see what else we can do. Like the hospice wing, and maybe she can give us some other ideas.
So logically in my head, the amount that we charge for EAV, for those that own property in LaSalle County, they're doing their part to actually maintain a person's wealth that they worked so hard for when they get to the point where they need geriatric care. That's another bent at it. Is that an admirable thing to do? Or should we just say, ah, the heck with you?
Well,
Business is business.
well, we're probably $36,000 a year cheaper than any place else.
3,600 or
36,000
per person?
per person, per year.
Well, then we've got to tighten up.
Well,
Yeah. How do we,
so I pay $32 a year for possibility of maybe saving $36,000 a year.
if you go to the nursing home?
Yeah.
If the kids don't kill you first.
Oh, hopefully they find a big pill.
I have to add a little humor because the morbidity that we talk to, the responsibilities that we have to, you've got to put a little bit of lightheartedness in it. It's a difficult discussion. Mortality and all that stuff.
Very, at 224 for 365 days a year, it's $81,076. If we raised it to 207, the price of ours would be $75,555 for a year. So we're looking at,
What's the difference then?
about $6,000.
That would still have to go to the board, right?
Than the lowest one.
That would still have to go to the board, right? If you decide the price.
Oh, yeah.
Yeah, $6,205 difference. And I did the lowest, let me see,
Well, you multiply times 360.
I did 365. Is it weird?
Well, that's what, is it a year, but everybody just has a 30-day billing.
Okay. Actually, I think I'm wrong.
Ron?
195, 365, 71,000, so it's about 10, I'm sorry. I did the wrong calculations.
If they're getting a consultant, wouldn't it be a good idea just to have a consultant tell you what to charge?
Well, I think that, yeah, I mean, we got plenty of time. The only thing is, Carrie's gonna have to start working on budget. Right. So it'd be nice to know, right, what numbers to put into the budget.
Well, I was just thinking, if you decide the price and you went through the board and you decided and you got a consultant, the consultant said, no, we need to go a little bit higher, it's like, you're gonna raise it twice within a short period of time.
Yeah. I mean, we could, I think we pulled off till next meeting to do so.
I think
And
that would be
get a consultant and
Find out what's
she can look at
get a better idea at the next board meeting, what's
Yeah.
going on.
Because hopefully by August, the finance meets first part of August. Hopefully they'll have some proposals. And pick somebody and
Is that wise that we spend? I think there's enough talent with this committee. And that's one of my problems, is none other than you being part of the finance committee and Mr. Walsh attending these meetings and our casual conversation, the only two members of the finance committee meeting that have even come and addressed us at the nursing home, other than making these, I call them snide comments, that our management of this facility, and you being the chairman of the committee for years, that we're malfeasant, we're not doing the right thing. I find that disrespectful. So they're gonna hire somebody to come in from the outside to tell us what we're doing, so they got an excuse to close the damn place.
well, I mean, yes, it's election year, and everybody's trying to say how they're gonna save the taxpayers' money. And yes, we're going through a financial difficulty. We've been going through it. We were very buying off until that tornado hit.
Yeah.
And since the tornado hit, we were too damn nice, and we kept everybody employed, or a lot of people employed for 9 months with no income, and we kept most of the staff employed for 3 months, sending them to other nursing homes to take care of our residents. We burned through about $700,000 with nothing coming in. And then COVID hit.
Yeah.
That time.
Yeah, I think consultants are great in their place, but, you know, we've had, you might say, in determining cost factors in this county government in relationship to what it costs to issue a document out of one of our offices. They'll come back and say, well, you need to increase it by $10. Well, between the office holder, the department head, or whoever's involved, and the committee and the board will decide, well, that's too high. Maybe we'll do it for $5. So, I mean, here we are again. We're back to the same thing. We're gonna hire somebody to come in, they'll tell us, well, to make them pay, you gotta charge this much. Well, we're gonna say, oh, that's too much. We're gonna cut it back. Well, it's just a vicious circle. I mean, we're not, you know, we're shooting at the sky and we're not gonna.
And everybody really knows what the problem is.
Yeah.
There's a shortage of nurses,
Correct.
and shortage of residents. I mean, there's not a shortage of residents in the county, there's a shortage of residents that are willing to go to a nursing home right now. Yes, Gwen?
Our tax rate was higher at one point in time.
Yes.
Is-
We had money built up, so we lowered it.
Well, is that a thought as opposed to raising the rates of the rooms?
I mean, the rooms, they need to be raised a little bit every year. Just
And
to
we
keep-
already did it this year, right?
No, this is for next year,
Yeah.
starting in
Okay. For
December 1st.
December 1st, okay.
This isn't immediate right now.
No.
This is next
Okay,
year.
I-
Okay.
so that we can.
And I mean, we're only charging half what we could for tax rate. Every other
Levy.
levy is just about, except for mental health. Mental health isn't up to their full 10
Took a
cents.
lot in half for the highway department.
Highway's all maxed out.
Yeah.
Imagine cutting that in half.
I don't want.
Well,
Hey, bean counters wanna save money, let's.
yeah.
I mean, LaSalle County's very fortunate. We have good roads. We have a good police department, jail, we built a new jail to take care of everything. 708 board, we try to help a lot of the service agencies in the county. And now all of a sudden, well, we don't need to be a healthcare, nursing home business. Well, if we're gonna stay a good county, we gotta take care of everybody in the county, not pick and choose.
Yeah, because they were taxpayers once too.
Yeah.
I agree.
You can't forget about it. How they pay them.
And can I just say something?
Yeah.
Cause I was when I presented the speech and it was, tabled. At the nursing home, we felt very, uncared for when that was told because we endured so much in the pandemic. We lost a lot of residents, that was our family members too. And when that was tabled and other things were automatically okayed that didn't involve human lives or dealing with the pandemic, it felt like a slap in our face, like we didn't matter. And that hurt a lot of people at the nursing home, including residents, because family members were coming in to my office saying, keep fighting, we know you deserve that, that was not fair. So there's a community also agreeing that that was very, I don't even have the word, not fair for what we went through. And that's just money that we feel we deserve that.
We agree.
Agreed.
I was down there that morning. I did not think the board would ever do that. Because we set guidelines on how we were gonna do it, and then all of a sudden, we're gonna change the guidelines? So what are you gonna do with just hold off on the rate?
Yeah. Let's hold on.
Okay, next thing is, have you had a chance to find someone to be new, medical director? Or is this,
That's in the executive?
yeah, second one?
Yeah, so,
Okay.
Yeah.
We can make a recommendation, we send it to salary rate.
Make a recommendation to send the medical salary and the resolution.
Alright.
Oh, salary waiver doesn't have a set salary?
Contract,
Okay,
so they don't have any.
okay. Well, first off, what is the compensation right now?
I'm sorry, I don't have that, it was almost 18,000, 17,000 or something, I believe.
Bills. Mike, you got last month's bills there?
I do. And you're looking for?
Medical director payment, is there, I didn't see it in there,
What would that come through as a
but yes,
payroll?
Payroll.
Waste?
what's your recommendation here?
18,
18?
yes.
Part $18.
No,
It's
18,000.
18,000 a year, and I did ask them,
$18,000 a year?
I know that doesn't sound like much, so I did speak to them. They said that's actually pretty good for a
And that's a part-time.
no,
So many
it's
hours.
contracted, it's not so many hours, he has to be on call all the time. He could come out anytime.
So did you get the person you'd like to have?
I'm sorry,
Did you get the person you would like to have?
did I get, yes,
You did.
yes.
Okay, there's no name in here, so I.
There's not, because we have to discuss some things.
Yeah.
Exactly.
That doesn't normally come to us.
What?
A bill.
Well, they're billed, but they're paid like every other month.
Well, and sometimes we weren't getting the bill from them, yes, it should be monthly.
can't we do it for 1 year? Or do they just want a year's contract?
It's, okay, it's a 2 years contract, my impression. But he's gonna be, finishing out Dr. Brunel's term, which would be November,
Okay, that's, okay, I see
Yeah.
now, yeah.
and then we would go,
So we'll do another contract.
then we'll do another contract.
Okay. Well, can't we do one contract from August 1st, 22 to November of 23?
We could. There's some things I really need to talk about and discuss and get opinions on, and that involves names and things, so that would have to be discussed in executive session.
We have, again, with that said, is a motion to go into executive session in order then? Or should we wait till next?
Well, we gotta wait till Amanda comes back.
Okay.
I mean,
We have people,
We have other,
there's other things.
other things on the agenda
okay,
we need to address. Okay.
what's this new tax?
Okay, so e-fax, we have had many problems with our fax machines. IT is out numerous times, just up and down and up and down. In the medical facility, you have to have physician's orders, you have to have faxes come through, especially admissions. IT was in and they brought up an e-fax, which is like an email. It would be cheaper, so I did a cost analysis of the paper, the toner, the ink, the labor. $275 a month for e-fax versus $326 we're spending right now with the fax machine and paper and toner, and that's not the hours for IT coming in, fixing it, buying new parts. It's more cost effective and it's better for us. It's an email and it goes directly into the chart if needed. Yeah, encryption is there.
Oh, it is?
It is. It would help us tremendously. You might get 100 pages for an admission in shred, cuts back on tons of shred too. There's a lot of papers that come through, but a lot of problems we're having. We need those orders, we need that, and people are standing at the line at the fax machine.
And is there a monthly fee?
Yes, it's $275 a month,
$275 and nothing else.
nothing else. That gives us, did I write,
Well, can you delete a bunch of the garbage out of it that you don't need then?
pardon?
Can you delete part of it, the extra stuff you don't need? You say it's 100 pages long.
Yeah, but they're gonna send it all. The hospital might send it all, and it's all amongst everything. Plus physician faxes, it's a lot of paper we go through. There's a lot of wasted paper because we shred a lot. And then if it goes in the chart, once you put in the chart, you're shredding it. This, there's no shredding. It goes, it's all,
You can print it if you need it.
if you need it, you got it.
And there's no other cost other than the $275.
Yeah.
It would be, you don't have to buy any new equipment, you don't have to do anything.
No, IT would come in and set it up, it's email, so each nurse's station would have that direct email where they do the faxes through. The only time you would actually use a fax machine is if, let's say, a family member needed a fax or something, well, they're not gonna probably have e-fax. If they don't, then they would fax us something,
So you're still gonna utilize the fax machine.
on
You'll
occasion,
have it.
on occasion.
Motion, go ahead with that.
Yes.
Kathy, Wayne, all in favor?
Aye.
Opposed? Motion carried. Okay,
What's this?
copy? Yes. 18,000 is what is paid now.
Okay. That is what it is, 18,000?
December 1st, 2021 to November 30th, 2022, 18,000.
Thank you.
Thank you. Now, do we need to go into executive session if we're gonna discuss a name?
I will go into
Yeah, see you later.
Yeah.
See you, ladies.
All the details in regards to this.
Okay. You wanna stay for executive session?
I got 11:30 appointment, Joliet, I gotta roll.
Okay. Okay, motion to go into executive session for 5 ILCS 120-2, employment compensation county employees. Do I have a motion? Elmer, second by Kathy, roll call vote. Okay, Luann,
Aye.
Kathy,
Aye.
Elmer,
Aye.
Ron. Where'd Ron go?
He went to Joliet for some.
No, I thought that was Bob.
Oh, no.
Did Ron
Should
go?
be coming back.
I don't know. Which one?
There he is.
Ron, do you think we're going into, executive session?
What's that?
Going to executive session, discuss? Bob, well,
Yeah.
I vote yes. Okay, we're in executive session. We're going in.